Let's turn to Claire San Filippo, Emergency Coordinator for the charity Doctors Without Borders, which has teams in the Palestinian territories. Thanks for speaking with us here on France 24.
Thanks for having me.
Have you been able to speak with staff this Tuesday?
Absolutely. We talk to staff every single day and various times a day, given how volatile the situation is. And what we're witnessing is a deadly escalation in the Gaza Strip and specifically in Gaza City, which still hosts close to 1 million people. So what colleagues tell us is that, they're subjected to relentless bombing by the Israeli forces. And every day there's been an increased number of airstrikes during the last week. Every day Palestinians are injured and every day Palestinians are killed.
Your teams are present how far north?
So we currently have a team continuing to work in Gaza City, and obviously they're subjected to the exact same situation as everyone else. So as you know, on the 9th of September, the Israeli forces issued an evacuation order covering all of northern Gaza. So people were urged to evacuate to a so-called humanitarian zone, even though we need to be utterly clear that there is no safe place in Gaza. So colleagues, are wondering if they want to stay and also if they can leave, because the UN has reported that almost 70,000 people have moved south. People are fleeing using a coastal road, Al-Rashid, which basically is currently the only option available to move from north to south, is extremely congested, as you can imagine. But many people are not willing to leave, also because, as this Palestinian woman was saying earlier in the interview, people have been forced to leave on multiple occasions, sometimes a dozen of times. And for many others, it's important to say that it's absolutely impossible to escape. And that would include the elderly, the critically wounded, sick people, women who are heavily pregnant, people with disabilities, but also people who do not have the financial means to leave. The cost of transportation are reportedly through the roof. Colleagues speak of $1,000 to basically move from the north to south. And everybody is asking, all patients, where are we supposed to leave? And there is no safe place. What will I do once I leave? How will I find a place? We were talking to a patient who was saying, honestly, I can't handle another displacement, so I will die in my house.
The UN's humanitarian agency talking about the Israelis forbidding aid from reaching Gaza City in the past days. What's been your experience and your dealings with the Israeli government when it comes to funneling supplies that your own staff need to treat the wounded?
Absolutely. And just to, in Gaza City today, I can tell you that in just one clinic that, we run, we had over 250 patients coming, a lot of them wounded. And what we've seen in the last few days with the escalation of the conflict is not only an increased number of people wounded, but also increasingly serious injuries. Some wounds are absolutely horrific. And that is what doctors are saying. Medical staff who are used to treat wounds are saying they're just basically gaping. And some of these wounds are now infested with maggots because people do not have the means to seek healthcare. The entire healthcare system is collapsed. So there are not enough beds. There are not enough supplies. So supply is absolutely a key concern. And what we've seen, unfortunately, since the beginning of the conflict is that the Israeli authorities have deliberately choked Gaza, imposing a total siege with severe restrictions on fuel, water, food, and medical supplies. And as a result of what constitutes collective punishment, famine, has been confirmed at the end of August by the United Nations, and that systematic deprivation of aid has led to preventable deaths, to malnutrition, and also to a profound trauma that will scar people in Gaza, not only today, but for generations.
I want to thank you so much for joining us, Claire San Filippo of Doctors Without Borders.
Thank you so much.